Um, I'm very pleased to say that I'm joined by Dr. Bharat Pankhania. He is Senior Clinical Lecturer in Public Health Medicine at the University of Exeter. Dr. Pankhania, isn't it brilliant that we're actually talking about this today?
It is. Good afternoon, Sangita, and our listeners. It is an important, very important subject to talk about. You know, as you were giving your report, I was reflecting on when I used to lecture on this issue, and I used to say, if you have a myocardial infarction, in other words, a heart attack, you will get an ITU bed that hour, hopefully. And on the other hand, if your mind is broken, you will be unlikely, most unlikely, to see a specialist, a psychiatrist, or get a psychiatric bed for months on end. And therein lies our problems with looking after mental health, which is much, much more common than your heart attack.
Listen, my understanding is, and you can tell me if this figure is correct, 1 in 4 people will experience a mental health issue in their lifetime.
Indeed, and that is also the tip of the iceberg that we are aware of. It is part of the human condition that sometime in our life we will feel anxious, depressed, low, and then a small percentage go on to have those psychotic episodes, and then a smaller percentage still have permanent, what we would call schizoaffective psychosis, and they need looking after forever.
Yeah. And when we talk about mental health, it is what you've just described, such a broad span, right? So there is low-level depression at one end, which can be caused by a multitude of issues. And with the right therapy and help, and sometimes medication, you can get over that. And then, as you say, at the other end of the spectrum are really serious psychiatric disorders. You mentioned there a crisis in mental health care in this country. Just outline what that is at the moment.
So we have, through decades, reduced the capacity, the bed capacity for mental health services. We took the line of we will do care in the community, which means people who needed looking after, we would look after them in little houses and little homes and be well managed. But unfortunately, there are many, many people who do need hospital beds, and we haven't got them because we cut them. We closed down beautiful mental health hospitals. I'm not saying that we needed as many beds as we had before, but we've cut down a bit far too much.
Can I ask you something? Why have the cuts fallen, and some people say disproportionately, on mental health support? Is there any interplay between the cuts falling there, and very little resistance to it, quite frankly, and the fact that we still feel uncomfortable about talking about mental health issues?
Well, in a way, Sangita, you answered the question, which is there is a drama if you have a sudden heart attack. There is a drama if you have a road traffic accident and your leg is fractured, etc. Whereas with mental health, there is a subject that we don't like to talk about, and therefore its advocates are fewer. There isn't that drama of sir, madam, pupil, person are feeling low and they need support, and they haven't got the advocate. So when people wish to cut that cake smaller, easy to do and easily done, and they've done it. And unfortunately, we also have health economists. Health economists are brilliant, but health economists are not psychiatrists. They're not mental health experts. So the health economist says on a cost-by-cost basis, well, we can cut it like so. What they cannot take into account are, for example, take Sajid Javid. His brother ended his life. Sajid is left damaged, is left upset for decades on end. And that cost is never built into the funding, that if a bad event were to happen, it leaves the survivors with a cost. And that cost was several years and decades, if not forever. You see, and when you cost it like that, you would actually say, you know what, mental health is everyone's business. We should invest in it, and we should break down these taboos. You mentioned to your workforce, by the way, I feel depressed. People see it as this is my weakness. My boss will use it against me.
Yeah, you can't cope at work. You shouldn't be here. You get sidelined for promotions and all that kind of thing.